effective programs and policy can make a huge impact in reducing tobacco use.
3 Canadian health organizations are calling on the country's provinces to seek measures to reduce smoking in a settlement with major tobacco companies that began 4 years ago, but are frustrated not to have a seat at the table. In an open letter, the Canadian Cancer Society, the Canadian Lung Association, and Heart and Stroke Foundation urge governments to make cutting tobacco use a top priority, part of a lawsuit provincial governments filed seeking a collective $500 billion in damages from 3 tobacco companies. Rob Cunningham with the Canadian Cancer Society says it's a major problem that tobacco companies are at the negotiation table, but health organizations are not.
Provincial governments should be hearing from health organizations with expert recommendations as to what can be included in the settlement, and provincial governments should be open to say what their priorities are.
We reached out to Manitoba Premier Heather Stephenson, who is the chair of the Council of Federations, a collective of all provincial and territorial premiers, asking why health organizations are not at the table. A government spokesperson says they are unable to comment at this time as the process is in the courts. Dr. Leslie James from Heart and Stroke says smoking causes around 46,000 deaths in Canada annually, and people who smoke are twice as likely to have a heart attack, and they are twice as likely to die from heart disease and stroke.
We still have about 12% of people in Canada smoking, and this is because the tobacco industry has preyed upon people for decades.
The health organizations say at least 10% of the money from a settlement should go towards long-term funding to slash smoking, such as support programs and research to help people quit.
The government of Canada has a target of 5% smoking rates by 2035. Right now, we need to ramp up tobacco control efforts for us to get there.
Cynthia Callard from Physicians for a Smoke-Free Canada says keeping tobacco companies in business is detrimental.
We are right now still mopping up the enormous problems that they caused between, say, 1950 and now. So we think that essentially the way to deal with this industry is to get rid of it.
Canadian Cancer Society says tobacco use causes multiple diseases and 16 types of cancer, including lung, throat, esophageal, and pancreatic cancer. Cunningham says tobacco companies need to be held accountable for the damages they have caused.
This settlement must have measures to have controls on tobacco companies so that public health is a priority going forward.
In Winnipeg, Alex Karpa, City News.